Welcome back, everybody. AM Buffalo is live and on the road this morning in Jamestown. Now, we have so much in store for you, not to mention the beautiful view that you're going to see when you make the trip here along Chautauqua Lake. It can't get much better than this. You can see the leaves are beginning to change colors. This is the perfect place for a fall destination. And if you're wondering where we are this morning, we are at the Harbor Hotel, and there's a lot in store for you here. Of course, it's very historic, from the stories of Lucille Ball to the beautiful Chautauqua Belle that travels up and down along the lake. But Linda has been out here traveling out and about, and she is checking out one of the area's thriving businesses. Take a look.
Hey, here in Jamestown, everybody, the Western New York Urology Associates offer excellent medical care. Now, I have with me Drs. Ryan White and Peter Walter, and they joined me this morning to talk about BPH, or an enlarged prostate. So good morning, gentlemen. Thanks for having me here. This is a common condition. I understand 40 million men have it, but doctor, only 12 million are treated for it?
Yes, it's very interesting that although people recognize these urinary symptoms, very few actually seek treatment for it.
Maybe we can talk about the symptoms.
Well, the symptoms are usually obviously urinary in nature, getting up at nighttime, slow urinary stream, urgency to be running to the bathroom, frequency, going multiple times more than what people would want.
Doctor, what if people don't seek treatment?
Well, it can go in a couple different ways. Sometimes it doesn't make too much of a difference, and it's only a minor inconvenience, whereas other times it can result in urinary tract infections, bladder stone formation, actually even kidney damage, and sometimes irreversible changes to the bladder that just can't be fixed as time goes on.
Is there a certain age that we start looking for this more?
Usually it's around the age of 50, some at the age of 40, but as you age, that's what you're going to be recognizing. You will see those symptoms come up.
Now, there are good treatments for this, but one that this office offers is the UroLift treatment. And Dr. Walter, you can recommend this treatment because you have this yourself.
That's right.
Yeah.
Yeah, the UroLift is a minimally invasive procedure that can be done in the doctor's office in about an hour. It's really a revolutionary treatment because it doesn't destroy prostate tissue or remove prostate tissue. It simply moves obstructing prostate tissue out of the way, where it's held in place by tiny implants, kind of like tiebacks on a window curtain. And this restores normal flow by opening up the passage called the urethra through which the urine flows. Most patients don't require a catheter afterwards. It's the only treatment that preserves sexual function in 100% of men, and it can be offered to men as young as age 45.
Do they have to be at a certain progression in their disease to get this?
We use something called a symptom score to identify the men who are having enough symptoms. And it's usually to the point where it's affecting their quality of life. In my case, you know, as a middle-aged man, I think that having the UroLift done was the best thing that I could have had to really improve my quality of life and my overall health. When I had it done, there was no other physicians doing it in this area, so I actually went out of town. I had it done on a Friday, drove to visit my daughter in college on a Saturday, and was actually back to work on Monday.
Wow.
I mean, most patients will have a little bit of blood in the urine and maybe some burning and some urgency that can last up to 2 to 4 weeks. In my case, it was really just a few days, and then I was pretty much back to normal.
And I understand, Doctor, that this office, you have actually been designated as a UroLift Center of Excellence. So congratulations for that. What does that mean to you and your patients?
Yeah, the Center of Excellence is a national program that recognizes physicians who really achieved a high level of training and expertise to provide the best outcomes for the patient. Dr. White and I have been designated as Centers of Excellence in Jamestown. Dr. Shevely has been designated as a Center of Excellence in the Buffalo area.
And folks, you'll be happy to know there are 11 local offices here in Western New York. But if you're in Jamestown, we've got Dr. White, we've got Dr. Walter here at the Western New York Urology Associates. If something like prostate now has gotten your attention and you want to go and see folks who can really help you, do ask about the UroLift technique as well.